So congenital means something that is present at birth. And when you talk about congenital heart disease, it is a term that we use to describe a number of different conditions that affect the heart. These heart abnormalities or defects are problems that occur at a baby's heart when it is developing during pregnancy, before the baby is born. Now, there are specific steps that take place in order to form the heart correctly. But if one of these steps don't occur in a right order or do not occur at all, then the child is born with a congenital heart disease. Because heart abnormalities occur when the baby is developing during pregnancy, it makes it one of the most common birth defects. In the UK, 1 to 2% of the population will have a congenital heart disease, which means that about 6 to 8 in 1,000 live births will have one or the other form of a heart defect. Now, in most cases, when a baby is born with a congenital heart defect, there is no known reason for it. It is just an unfortunate step that happens during pregnancy, and the heart is not able to develop on its own. However, there can be some risk factors that can cause congenital heart disease, and they could be forms of genetic or chromosomal abnormalities, which means that there is a genetic defect the child has also got, which then causes them to have a heart defect as a result of it. Rarely, it could be some maternal causes that can also increase the risk of a baby being born with a congenital heart defect. That could be a maternal infection, diabetes, or some connective tissue disorder type of abnormality within the mom. But often in our experience, we always see that most children do not have any reason for them being born with a congenital heart defect. There is also a slight increased risk if there's a family history of congenital heart disease, and this risk increases by 2 to 3% in the first degree relative with congenital heart disease. We don't really see the increase if families have second degree or further down the line with relatives having congenital heart disease, but only applies to the first degree relatives. So congenital heart disease is a spectrum of disease, and it can be from very simple to complex. It also depends whether the complex congenital heart disease is picked up when the child is a baby or a young child. So it also depends on the age of the child when the heart condition is picked up. Now, as a result of it, the presentation can vary a lot depending on when you have identified a problem or a symptom or a sign. Now, the most common features or presentation that we see is a blue tinge to the skin or lips, which is called cyanosis. They could have a rapid heart rate or a rapid breathing, sometimes also shortness of breath. And as a result of this, the baby with shortness of breath and rapid breathing can have a very reduced feeding, and they are not able to keep up with their appetite. In older children, you might see symptoms of being very tired, fatigued, lethargy, where they're not able to perform their routine activities as best as they could before. And all of this gives an indication that there could be something wrong with the heart and towards in congenital heart disease. One of the other things that we also see in babies is it's called failure to thrive, which means in medical terms, inability to gain weight. And if a mom or dad were to go through the red book of the child and see that their weight is not growing on the centile lines, it would be an indication to suggest that there could be something wrong. And one of the reasons could be a problem with the heart. Occasionally, you have rare conditions where the child or a baby could present themselves in significant heart failure. And during that time, they can have swellings in their legs. Again, they might have shortness of breath, swelling around the eyes or face, and inability to keep their appetite, reduced weight. And they could all culminate into having signs suggestive of they've got some sort of a complex or difficult heart condition. As I said, there is a spectrum of heart conditions that babies or children are born with, and depending on the complexity of the cardiac lesion, they can be very mild or simple, or can be at the very end of the complex spectrum. It is important to realize that about 25% of patients who are born with complex congenital heart disease or critical congenital heart disease would require surgery within the first year of life. Most patients require some sort of surgical treatment or procedure, which is the only way you can correct a heart defect which you are born with. Patients who have conditions like heart failure related to either a normal heart or a heart muscle disease may require medical treatment in the first instance, but occasionally they also require further intervention or procedures to help them with the treatment. So most congenital heart defects would require a form of treatment either straight away or in due course. Complex congenital heart disease is a spectrum of disease from a very simple problem to a very complicated structural problem in the heart. And majority of the patients would require either cardiac surgery or some sort of procedure to help treat the problem. Not all patients get completely treated. So some of them have a management plan called palliative care or palliative treatment, which means that you're able to treat some part of the heart disease, but as you move on, the further treatments might be possible or not possible. However, majority of the surgeries and treatments are available with really good outcomes in this day and age. It is also important to note that 25% of patients born with critical congenital heart disease would require surgery in the very first year of their life. So we work with a lot of small babies and children who require heart surgeries very early on. And as a result of this being a complex problem, most children with congenital heart disease will require lifelong follow-up and ongoing care, even as they turn into adults. Now, because of the advances in medical technology and the science, majority of our patients are now able to transfer to or transition to adulthood with their congenital heart disease, and about 80% of them will, in the current stage, are living with their heart disease as an adult. It's also important to note that there are some conditions within structural normal hearts which might be treated with medical treatment and might not require surgery in the first instance. However, many patients would also require surgery or some sort of intervention later on in these situations as well. So it's quite a complex area which requires most of the time treatment, and many patients will completely recover, but occasionally we might not get the full treatment available to these patients.